Good morning. So I think it's yet another day where we are going to start on another concept on special needs. So I want to welcome you for this class. The class will be recorded again, but I don't think I will be able to post special needs on YouTube, but I will just record it for purposes of accountability. So when you look in your WhatsApp, you can be able to see I have posted there the course outline or the objectives that we wish to achieve by the end of this course. So I'm trying to have access to it so that maybe I can be able to share it out for those ones who may not have accessed it. So that we can begin this lesson. Yes, it is here. So basically, this course is called Challenged Persons, or they're just people with special needs. So the module outcomes, we are expected to identify people with special needs. So by the end of the lesson, we should have known who are these people with special needs that we want to talk. We're going to talk about the challenged person nursing, how we can be able to assist them when as community health nurse, and then the social services that are available to be able to care for this, or which you can be able to refer this patient to be able to get assistance. So that is basically what we are going to cover in this lesson. So it is not a very, very big lesson, and it is a lesson which borrows much from experience, from what we have been able to observe, from that is basically, or I can say it is from our own observations and our own past experience. So it is not a very technical course. It is a course where you can be able just to borrow much from your experiences. So to begin with, when we want to talk about people with special needs in the community, we have quite a lot of these persons within our community whom we live together with. They are there with us, and we see them on a daily basis. So persons with special needs, we can be able to say we have children who have been abandoned, who we can be able to say or qualifies to be persons of special needs. We can be able to have elderly persons who live with us. We have people who have been displaced because of various conflicts, various reasons. It could be because of any catastrophic occurrence in the environment, such as earthquake, such as volcanic eruptions, such as flooding, and so on. There are those who have been displaced because of warring factions, where we have both the internally displaced and the externally displaced. We also have persons who have chronic illnesses. We shouldn't forget, or we should give them a special mention, because these are people who are with us. They require a lot of specialized, or to be treated quite special, using quite special than the general population. So those are some of the persons with special needs that we are going to talk about, to discuss, and be able to see how we your jurisdiction. And you know, in the community, we have family, yeah, we have families, which is basically the smallest unit of organization within the community. So when you're talking about community, we're talking about a whole host of structures where we can be able to use or utilize to be able to assist these people with special needs. So to begin with, we're talking about a child in need. A child in need is one whom we can say has been either been abandoned, has been orphaned, or one whose parents are incapable of looking after them properly. So within our community, there are these children. You may have seen them. You could have been at one point been a child in need. You could have been abandoned, could have been orphaned, or your parents simply were incapable of looking after these children properly. That is in terms of provision of basic needs, in terms of food, in terms of adequate shelter and clothing. So you find such a child who has been abandoned or orphaned need the best possible alternative arrangements for their care in the absence of their parents. So these children who are in need are children, you find that most of those children are malnourished, meaning that they are not well fed, therefore they have nutritional needs. They need parental love. Their parents cannot be able to accord them because maybe they are not there. Maybe they abandoned them because of various reasons. It could be that these children were born with some malformations. The child was conceived out of incest, you know. So such kind of children you find in our community, sometimes they can be abandoned and therefore they need the parental love. Because of absence of these parents, you find that there is also lack of education. They cannot be able to afford education. There is lack of access to healthcare, such as those children who are born of parents who at one point had or were diagnosed with AIDS or HIV, and maybe they could have passed away. So you find that it is a challenge because they are young. They cannot be able to afford or have access to healthcare. There is security and protection from harmful practices like the female genital mutilations. There is forced marriage. Sorry. There is forced marriage within our communities. We also have those children, they may have stigma and discrimination because maybe they're orphaned because of their parents passed on because of AIDS. Obviously, over the years, at least this stigma and discrimination has been, we have tried as much as possible to reduce the stigma and discrimination. However, we have not been successful in eliminating them. So it is a sad affair that even in this century, you find that this stigma and discrimination is still part of us. So also social burden, such as care of other children, because they are the only survivors within their families, you find it becomes a need to them. So they also have poverty due to lack of resource or income to be able to sustain their families and themselves. And then, of course, that comes to inadequate lack of shelter. So basically, when you look at these needs, you can be able to summarize that their major need is security. There is, when you use the Abraham Maslow, there is the love and belonging. you can be able to see very clearly that the physiological needs is not there. The physiological needs, like just food, yeah, the basic needs that we need, is the shelter. We're talking about shelter, food, clothing is not there. Yeah. So insecurity here, we are talking about the FGMs, forced marriages, devices that children within our community can be able to face, including rape and even sodomy within the community. So you find these children are so vulnerable. Yeah. The word here is vulnerable. They are vulnerable such that if we don't take care of them, then they may not be able to survive to be good citizens. Some of them you may find now they may deviate, they may go and join crimes and also practice some of the activities that may lead them into problem. So what kind of services are available for children in your community? This is a question that once you are posted or you are placed anywhere within the Republic, it couldn't not be directly linked to your scope of practice, but it could be just maybe you have been called upon to be able just to advocate for these special needs persons. It could be you are an active member in a church that maybe want to also participate and assist your community around. So you have to know that there is children's home which can be able to, which are owned and run by individuals with the help of donors and well-wishers. So for this children's home to be able to thrive and be able to assist, then it relies majorly on the well-wishers and donors. So even you at particular time, you can't be able to just be a donor out of your own will. You can't be a well-wisher. You go and sponsor a kid somewhere and assist them so that they become. Remember, there are children who are at need or in need, not because of their own volition, but because of circumstances that could have placed them. So these children home, they provide children with basic needs and education. And these homes usually are supervised by the Ministry of Social Service. So even if you want to open a children's home and run a children's home, you must go to the Ministry of Social Service and then register and then issued with a certificate to be able to run those homes. So we also have approved schools for those children who may have deviated from good manners. So these approved schools are usually there to be able to try and correct this behavior. So example, you may find Kirigiti in Kiambu, you may find another one, Wamumu in Mwea. There is another approved school in Kakamega there. Yeah, and those approved schools are usually run by the government. We also have remand homes. So these remand homes are for those children who could have committed atrocities or they could have broken the laws of the land. So they have been taken to court and then they can be sent to remand homes so that they can be able to serve the period at their behavior can be corrected. So these are available in the community and also they are run by social services. So in the hospital, most abandoned children you have to know are brought to the hospital. You find a 3-year-old child, a 4-year-old child, a 1-day-old, they have been abandoned in a coffee plantation. So the first place that they will be brought to is the hospital to receive medical care, and then they can be handed over to the children's department for adoption, or they can be sent to those children's home. yeah, or also institutions, depending on the age of the child and the needs of that child. So we have integration and rehabilitation. So once we take care of these children have to be integrated and rehabilitation back to the community. And as the community, we have a role to be able to ensure that these children grow and attend school, to be able to acquire skills so that they can be able to be independent, where they can become productive persons within the society, they can get employment, they can create employment, and therefore become useful members of the community. So a child, basically, when you look at this, a child is a responsibility of the community. It is all of us coming together to be able to produce an individual who will come to be a useful member of the community. You know, the yesteryears, you could find that the community used to help a lot, whereby you could find those people, maybe if you are born later than 2000, in 90s, in 80s, you'll find the whole community will be able to discipline a child. Any senior member of the community will be able to discipline a child when they deviate. Anyone. And it was acceptable. But now things have changed. Like now you can't just go and touch someone's children or a child because maybe they have deviated to the social norms. It will bring a lot of issues. And now maybe you can be able to see as to why the generation that we are having, we are constantly having to deal with rogue youth. We are constantly dealing with newer crimes that are coming into place, because it's like the whole society or the community has left its job to one person or an individual. And this individual often is not at home, is away. You go for jobs, you come to school, you have left the children at home, so they don't have a lot of support and also people to try and mentor them. And of course, even the community, the senior members of the community nowadays, some of them, their behavior is not good, whereby you cannot entrust them to with the life or the life, basically, or the well-being of a child. So there is a lot of things which have come into place that has changed the whole or eroded our culture as Africans. So how do we reduce? How then do we reduce these children in need? Because if we have them, we may not be able to eliminate them, but we can reduce them. So we can reduce that by strengthening the family relationships in the community, so that such children are taken care of by the immediate family members, especially in the cases of orphans. We should strengthen. People should love one another. You should look at a child of your sister, child of your brother as your own, and provide a conducive environment for a child to grow. Remember, these people did not wish to find themselves in their circumstances. It occurred to them that maybe they become orphans, and therefore they cannot be able to sustain their needs. So also, we can reduce by providing family life education to the youth on consequences of premarital sex, since many of the abandoned children are as a result of unwanted pregnancy. Very important. So that is why you should be able to champion. You are a nurse, you are qualified. Take time, even on holidays, in your church, in the social gatherings of the youth. Take time just to emphasize on the message. It resonates with some it may not resonate with them. But you tell them, you give them skills of preventing unwanted pregnancies. You provide for them the condoms, for instance. You encourage them to be busy so that they can be able to be productive and avoid the consequences of premarital sex, which most of the time it comes with abandoned children. So you find the father or the person who is responsible for the child disappears, and also the mother disappears, and then they leave the child. So it is a very sad affair. Also, we can reduce by implementing safe motherhood initiatives in order to prevent maternal death. So when you are looking at your patient has come to the clinic, yeah, or you are able to see pregnant women, do you find time to talk to them, to encourage them to come to health facilities so that we prevent or reduce this maternal death and end up with orphans? So we need to give this message. You tell them the way it is, that you should be able to seek medical advice throughout the pregnancy so that it helps the child and it also helps them, since if they have any issue and they are managed properly, we are going to avert maternal death, and by so doing, we are going to prevent children in need. We can also prevent children with malformations whom they end up being abandoned. So also providing family planning services is equally important so that the family get the number of children that they can manage. Also, by providing information to the community members on the services that is available for adoption. Yeah. So this will also help those members in the community who have no children of their own, as well as those with unwanted pregnancy. So you can tell them about the whole scenario of adoption, how it happens, so that we prevent those children who are unwanted from being rendered homeless. So that is about children as children who are in need. Unless you have any addition or any question about children in need, it is welcome to share with the class. Remember, we have said this one is a class basically that we get it from experience or what we have been able to observe. Okay. So we shall carry on. So we have care of the elderly, we have identified again as people with special need. So the aging process is often defined in terms of the physical changes that negatively affect the body's function and appearance. So old age is associated with poor health, poverty, and dependency. In the past, you found that the traditional systems used to support the elderly because it was so effective. You had to assist the elderly. However, nowadays you find that these systems have disintegrated because of the socioeconomic changes in the society. People have to move away in search of better life and income. So in Kenya, the elderly are defined as persons aged 64 years and above, although our retirement age at one point was 55, but nowadays people are given the bonus by President Kibaki to 60 years. Those ones in the civil servant, and then 65 years for parastatals like KMTC. We have tertiary institutions like universities where a person can go up to 75 years. You see, so it keeps on varying. It is not standard. It depends with your nature of work. We also have like the judges, you know, those persons who sit on the bench. They can go even up to 70 years. So it depends with the nature of work. Yeah. So it will be dependent on that. So either way, they are elderly. You can be able just to gauge them by their physical changes. So these people, or the elderly citizen in the country, has been increasing, and this increase will not be of much concern if you already had support structures in place to take care of them. But it is unfortunate that in our country, this has disintegrated, and we have left our elderly vulnerable to medical and social problems. Remember, they are not productive. Their productive years is past, and now they are in their sunset years. So the problems that they may encounter is poverty if they did not invest well during their time, and also things may just happen. A person may have invested well, but along a person develops medical conditions, and then this person is forced to to incur a lot in terms of medical bills, and then it leads to poverty. We have loneliness. They are away. They are alone in the villages. We have left them because of the socio-economical issues. Their nutrition is poor. They can be physically handicapped, dental and mental problems. They have a lack of energy to provide activities for daily living, inadequate housing for some cases, chronic illness, which is synonymous with the aged. You know, there are those things which you can't run away from the chronic illnesses if a person lives for a very long time. We also have age, where we have changes with immobility. They cannot be able to walk, and also presbyopia, where in presbyopia they cannot be able to see. They cannot be able to see small letters. They may not be able to read things that are very small. And then we also have a lack of care in sickness. And you find these problems are experienced by the elderly throughout the world. It's only that in some first world countries, they have been able to come with the home, the concept of home for the elderly, where you find at some point they may be taken to those homes and they be taken care of by the government. So in our part, we are also trying to come up. What are the available services to the elderly? So at the family level, what can we be able to do? At the family level, we are supposed to encourage the families to take care of the elderly persons. Encourage them, tell them that, these people are respected persons, they can be able to give you blessings, So you encourage them, you tell them about the needs. These people are lonely, these people cannot feed for themselves. Let them understand them. Let educate them on the needs of these persons. You also have to educate on importance of planning for retirement. Even you are going to join work. At some point, you are going to leave work. Yeah. So the moment you land for that in that work, you should also be planning for what? For your exit. These are the things even here at KMTC we are privileged. Sometimes you are taken to Mombasa and you are told that you are going to exit the service. They actually pay for us for a whole week just to go and be taught about planning for retirement. So you should be able to be saving something for the rainy days. Keep some powder dry so that when that time you don't become a burden. Yeah, start small. Even if you are getting 10 shillings, eat 5, keep 5. You are getting 10 shillings, keep 8 shillings, put 2 shillings aside for the rainy days. Know the retirement schemes that are available that can be able to assist you during your sunset age. So the aim for this is to prepare this elder person to remain independent and comfortable. We don't want a situation where you as an elderly person now, you become a bother to someone's life. Remember, these people are trying also to build their own life. They're also trying to create their own families. They have young families. They have their own challenges. And then you also add and become a burden. So you need to plan on the exit. So there is also need to discuss payments of pensions and allowances early for better what? Plan. So, but you know, here we have a problem where you find a person had retired in 1998, and up to date, they have not been paid their pension. So you need to have alternatives so that once your sunset days arrive, you can be able to sustain your life. So at the community level, we also can be able to implement can be able to assist this elderly by join peer groups to help them psychologically. So here we are talking about being active members of the church, social activities. You go to Europe, you find that the church is full of the elderly and few of the youth. So my friends, it is a challenge that you want to serve God when you are on a movie. You cannot even walk. So how are you going to assist? How are you going to build the church? You will come and sit there. Yes, we don't say that you don't assist, but why don't you help when you are strong right now, when you have money, where you can be able to buy a small seat, just say it is donated by you. People will sit on those seats and you'll get a lot of blessings. Assist, be active, go join, go to preach if you are talented, go and sing to God when you have strength. Because when you will now be lacking strength, then God will be able also to remember you and ensure that you do not beg, but you can be able to sustain your life. So it is important. Don't wait until when you are elderly is where now you join. Start now. Of course, everybody has their own time to be called, but you can also make your decision and ask the Holy Spirit to be able to take care of you. For those who are believers in Christianity, those who are atheists, continue being an atheist. Just assume there is no God. Go and form your own social groups and continue saying there is no God. It is your own. May don't tell anybody where to go. If you are a Muslim, assist in the mosque. Be able to participate in charity so that you can be able to assist in a community level so that even when you are elderly, people will respect you. They will accord you respect because you earned that. Yeah. So again, during home visit at the community level, too fast. So during home visit, you should also provide direct care to the elderly in terms if they have dental issues, eye problem, assist them. So also churches provide spiritual support as well as material support to the elderly. So the women and youth groups offer different types of care. When these groups visit the elderly, they can be able to alleviate their loneliness. They can be able to improve their nutritional status, where they clean for them. So it is important to assist this elderly. They also help them with repair work, gardening, and so on. So as healthcare provider, one of your role is to advocate for the elderly. Some of you, probably you are not called to be nurses. Some of you will just have the nursing knowledge, but you may never practice nursing. You may be called, maybe have been called upon to be patient advocate, or just to be a champion, to be for social justice. So these are the areas that you can be able to pick and be able to advocate for persons. So you should let their needs be known by the community by representing, airing their views. Where there is a policy making process, you also, because these people are voiceless, you can be able to advocate and champion and speak for them. So you should let their needs be known when things are being done within the community. So also have a positive attitude towards care of the elderly, so that you add life in their days. You need to support them. So institutions that are available for the elderly in Kenya, there are a number of homes for the elderly and daycare centers. And these centers provide nutrition, activities of daily living, such as personal hygiene. There is the treatment for any sickness, recreational activities, just like Bible studies. You can go there, talk among one another. There is also safety and comfort. And the best care for the elderly is one provided by what? Our family. Family is what is very, very important. I was just making this, I was just wondering, some of us, or some of you, or you may have heard people saying that they may wish not to have a family. So have you ever wondered now, during the sunset age, how lonely it may become, or what you may be doing? So you need to think about that. I'm not asking anybody to have a family, but think about it. Think about it seriously and see how you are going to cope should God allow at 120 years is almost 6 generations, going at our African way, where a person can be able to give birth at 16 years. So at that point, it's about 5, 6 generations. So people have been coming and going, but you are still there. So think about that issue and see. So we also have hospitals, where geriatric hospitals are well established in developed countries, where it is just for geriatrics, just to take care of the aged or the elderly. Actually, elderly is a respectable way of saying this person is aged. You don't call person an old person. It doesn't sound really nice. You just say elderly. It sounds much better. So in Kenya, the elderly do not have any special health services targeting them. We don't have specialized hospitals like in developed countries. And in some communities, it is commonly believed that the old age is a cause of illness. You go to Kilifi, the aged or our elderly persons are being hunted day and night, because people purport that these individuals are witch, or they practice witchcraft. You go to areas in Kisii, again, there's also a problem. The elderly are facing problem. They are being hunted by people, being set on fire by people just saying that they are witch. So in real sense, these people just want to eliminate them so that they can be able to get their land. And in most circumstances, you just find it is a close family members. So another reason why elderly may delay to seek healthcare is that they live far, again, from health services. So as a community health nurse, it is your responsibility to sensitize and encourage community members to seek healthcare for their elders. And even if you are in a position to start a program where you can just be out all the elderly within your community, and then even if it is once a month, you just, instead of you just waiting for the patients in your facility, you leave someone there and the rest can be able to go inside the community and be able to look for these persons. One thing I have to tell you as community health nurses, in the hospitals, we only have 1% of the population. The 99%, if you agree with me, are in the community. So you go and then close yourself in a room and wait for the community to come to you. So you should seek to go and administer preventive care to those nurses within the community. Yeah. So you need to go to them. That's why you see there is a gap which has been found there, and that is why you find that we are training now people with called community health workers, because the nurses are probably, they are either because they are few or because they do not want to go to the community to offer the preventive medicine, where they just would like to give the curative, have forgotten about this crucial role of working with the community. Because even if you have a clinic, you can be able to map these people with needs and visit them and give them referral at their home. Visit them there in their home. Be able to ensure that they have good hygiene. So that these people do not come to the hospital because of illnesses. Yeah. So there are a lot of activities that you can be able to incorporate in your care, particularly if you are working in a dispensary, a health center. You need to work close with the community so that your impact can be able to be felt. These are people with needs within the community, not with needs within the hospital. So you have to start training your mind that there is a lot that you can be able to do with our community. So we also have the chronically ill. Yeah. What is chronic illness? First, we have to understand what is chronic illness. Chronic illness is said to be chronic if it meets the following criteria. Number one, permanent. That illness ought to be permanent. Like HIV/AIDS, we have cancer, we have diabetes, we have hypertension, So it also leaves residual disability. It could be a person has some impairment. It is caused by non-reversible pathological condition. It requires special rehabilitative training of the patient, and also it requires long-term supervision and care. So these are the criteria. You may have been in a class, but you don't know the criteria for chronic illness. Should be permanent. It leaves residual disability. It is caused by non-reversible pathological conditions, and also requires special rehabilitative training of the patient, and also requires long-term supervision and care. So you see, these are still people with need. An example here, we're talking about persons with diabetes. You don't have to wait for a person with diabetes to come to the healthcare. Into your healthcare, you can be able to visit them at their homes. You just have a schedule, the few of you that you are working in a health center or a dispensary, to go around and assist this chronic illness patient, arthritis, hypertension, the sickle cell diseases, renal and heart diseases. Yeah, we have terminal carcinoma and other debilitating diseases. We have AIDS. All these are just but an example. We have others. So chronic illness, or the chronic illness, not chronicle, but chronic illness, affect many parts of life, such as ability to work, relationships, emotions, dreams for future, and personal integrity. So, in other words, when a person is sick or their illness, they have impairment or dysfunctional health patterns. Mm. So maybe if you can go and look at Gordon health or functional health, uh, sorry, health pattern. This one is a nursing assessment tool to be able to find out which are the patterns that have been affected, you know? So in Gordon's, basically is talking about 11 functional health patterns. It could be elimination, nutrition, perception about a person's health. It could be role and relationship. It could be coping and stress, stress coping. It's actually 11. So a person who is having chronic illness, you can be able to use Gordon's to be able to look at these patterns that have been affected. But mostly you will find their relationship and their roles being affected. So if it is a father or a mother, they cannot be able to attend to their wifely and husbandly activities. Their emotions, they are emotionally drained because they are no longer productive unwanted. So there is a problem with their health patient. They cannot be able to eliminate well, some of them, yeah, because their renal function has been impaired, their bowel function, that is the GIT, has been impaired. So when you use the Gordon's health pattern, the 11 functional health pattern, you can be able to go assess your patient well, form nursing diagnosis, and then you can be able to intervene with your patient and assist them. So chronic illness normally bring uncertainty on a day-to-day basis because this person is worried that he may not be able to finance their healthcare. They are worried about they cannot be able to support themselves and so on. So when they think about the future, they may worry about how illness and the uncertainty that are there. You're wondering, will this person I think I had lost you, so I'm trying to put up the presentation once more. Don't know what is happening. The presentation, the slides seems not okay. That one. Share. Yeah, so we're talking about the chronically ill patients, and we said that it brings a lot of uncertainty when there's a person who is chronically ill. So chronic illness or the chronic illness also varies with severity. There are those ones whom we can say those ones who are stable and those ones who are actually not very stable, and they may require some overwhelming treatment, which can cause financial pressure to the persons that are closely associated with them themselves, and this can be able to bring stressful ordeals. So, so chronic illness calls for different roles of patients and doctors than is typically true for a short-term ill, and the doctor has limited power because there is no cure for chronic conditions, and medications and often have limited effectiveness. So in chronic illness, more responsibility falls on the shoulder of the patients and the people who manage the illness. So basically, or I would like to tell you about when in our position as nurses, sometimes you find that you are maybe an ICU nurse, you are a renal nurse, so you are treating those chronic ill patients or patients who their sickness may take a while. It is very, very important for you to involve the family. Imagine the family has come to participate in care, and what you do in the wards, you chase them away. That masaa ya kuona wagonjwa imeisha, nobody is talking to them. You are not telling them how you are managing the patient. And then in 3 weeks' time or 2 weeks' time, you expect to discharge this patient and go home without any knowledge about the patient's illness. So what happens? The patient goes home within 2 weeks, the patient is dead, or patient comes back when he's seriously ill. So it is important as nurses that you include the patient relatives in the care of a patient. Give them education. Tell them what you are doing to their patient. Even in some extent, some of the procedures you must be able to do them so that the relatives can be able to see how you are doing it and practice. So that when you release this patient into the hands of their relatives, we can be able to have continuity of care. So imagine you are having a patient with traumatic injuries. They are having deep wounds. You know very well you may not treat in the hospital until the patient completely heals. And then you release this patient to the community members. They don't know where even to start, so you're even giving them stress. So it is important when you're working in the ICU, when you're working in the renal, that you include one of the relatives or close relatives whom you think or whom they have suggested that they can be able to help with the care of the patient. So you find you release a patient with with a tube, the tube feeding, NG tube feeding, or they have gastrotomy bag, they have just had tracheoesophageectomy. So this patient is going home, their relative does not even with the tubes in the patient's body. You just don't dismiss relative, because remember, care does not end in the hospital. You are going to release this patient back to their community. So it is important for you to involve them. Talk to them. Don't dismiss them. There are people in difficult circumstances. Yeah? Their patient is sick, so they are having a lot. So manage their anxiety by talking to them, to allay, informing them how their patient is going. So what are the available services for chronically ill patient or the chronically ill patient? We have a number of services that are available in the family, where you find most of these chronically ill patients can be able to be taken care by the family members. So in order for the family to care properly for these chronically ill patients, they have to be prepared and educated on the what? Requirements. You find that you are taking care of a patient in an ICU. You know, some patients are very wealthy in the beginning. The patient is having, let's say, a liver issue. So the patient has landed in the ICU. They have been able to purchase their own ventilator machine. They have even been able to purchase the ICU bed, complete, everything for them. And then you take care of their patient, and then you release this patient to the community. The community doesn't know doesn't have any knowledge, or they are not prepared to take care of this patient. So within 2 weeks, when the patient dies, yeah. So if you want continuity, I'm still emphasizing, I'm particularly passionate about this because I have noted that nurses and all medical practitioners often disregard the value of relatives in the care of the patient. I have personally witnessed in an ICU where you find a person has been admitted there for over a month, and then a relative or even a child, this patient has been unresponsive for a particular time, for a long time to treatment. Then a relative just come, and you find these patients' hemodynamics, the AEGs. You look at the ECG monitor, you see the blood pressure, you look at the pulse. It is suggestive of a person who is responding just because of association, that they are close family members whom they think they maybe they love one another is there. They are present, just helping care. So don't never disregard the family in the care of your patient, but seek to tap. Of course, there is also issue where you find the family members may be coming with some ill motive. They want this person to die quickly so that they can take their property. So it is your responsibility as the nurse to as well be able to know whom are the next of kin or persons who can be trusted with the family. So you find some family members, they visit the patient, and all of a sudden the patient, now you start doing CPR, because the patient who is in the ventilator has sensed that this person who is coming here is not a person whom I wish to be there. So you need to know. So this is important to help the family and patient to feel confident in the care at home by educating and preparing them. So the community, we have the community health workers, we have the community-owned resource persons who can assist, and we also have the community health nurses who can still be able to attend or provide home care. This can take a form of medical advice, material support, and spiritual support. And please, be compassionate. Show compassion to humanity. Remember that the same position that you are seeing your patient today could be yours tomorrow. Sometimes I sympathize. I see even my fellow colleagues complaining about some of someone calling this person to come and look, or to you refer this person This person takes time to even come and see this patient at home. And then when he comes, there is no compassion, just saying, you are too motherly or nini, like that. So until you even don't know what to say. So be compassionate to one another. It is a soft skill that when I give you slides, you go and read. You may not acquire them, but you people are almost going out there. You should understand that there is nothing like a patient who is difficult, but it is a patient under difficult circumstance. Imagine you on that bed lying for the whole year. Will you behave differently from this patient? So you find some nurses, that patient is nagging, anasumbua, mimi hata usiniweke huko. My friends, you chose you chose this profession. Compassion is something that you as a profession, because this is a patient under outcome, So please, when you are called upon to give your service, just don't look at a woman giving birth on the roadside and you seem to be okay with it. Ask yourself, this is your mother, this is your sister. How well could you have assisted? Maybe you are seeing a chronic patient, is demanding, that is feeling pain. Don't label them names. That's saying that your patient ni anasumbua. Helen, patient asumbui. The patient is under difficult circumstance. Okay, so I hope we have agreed on that. So we need to show a lot of compassion to one another, towards our patients, when or whenever we are offering or we are giving them service. Okay. So also institutions can be able to provide service to the chronically ill patients. And some of the institutions that we have are the hospitals, the hospice, where we can be able to refer patients who have cancer or the CA, that maybe it is 4th stage, 3rd stage. It is basically the management. We don't see any quality of life after management. So we send them to hospice where they can be able to take care of their pain. They can be able to talk to them and basically support them through the journey to either death, because that is the ultimate outcome. So they have a peaceful death and also a pain-free quality life. So hospital admit these patients during acute stage of management. And once this stage is over, they are discharged and followed up the consultant clinics. And from there, they can be able to be given medication to take at home. And hospice usually take care of terminally ill patient, where they teach the patient and their caregivers all issues concerning care, and also make follow-up at visit at their home and where patients are being cared for. So hospice, hospital, and also specialized clinics are available. So management of chronically ill patient is dependent on the stage of adaptation. We have said we can be able to use the Gordon's. If you don't know the Gordon's, functional health patterns, please go and read and see how you can be able to apply Gordon's. And then in the first stage, they tend to be in denial and disbelief. And during this stage, you need to be actively involved in the care of these patients, even if they are being cared at home. And then educate the family members to listen to all of the expressions of feeling by the patient without criticizing them. And they should also be empathetic. Yeah, they should be empathetic and listen to the arguments without being judgmental of who? Our clinically ill. So the patients in second stage of adaptation, they manifest what? Anger. These ones are in disbelief and denial. Because even if somebody walks today and tell you, my friend, you know you have, or as someone tells you, you know, my friend, I've taken your test, I've run your test, having fourth stage tumor. No, I can tell you it is not an easy message to bear. So denial will be there, then anger, and during this stage, the patient develops the awareness of the chronic illness. So you have to educate the caregiver to exercise restraint and self-control. We have already seen this. Normally, you find in our wards, we find these patients who are angry, they are denial, they don't want to take medications. You talk to them, they are rough on you, understand them. They are in a difficult circumstance. So you should exercise restraint and self-control. You should also tell that to the persons who take care of them. And then the third stage, they can now start now undergoing reorganization and is nourished with the concept of hope and should therefore give hope generously within acceptable limit, where you don't, if a person is tumor, you don't tell them that, you know, utapona tu, ati sijui Mungu, kona wewe, you know, those are for religion pastors. Or you can just give them hope that you, at least if we give you this medication, you're not going to feel pain. You're going to have some quality life. You have your kids around you, have your family around you. You have everything that you may have wanted. So you just support them. If they want some religious nourishment, you can be able to ensure that a pastor comes in. So you do it within your limits. Don't overdo things that are not yours. For example, now you start now putting your own ideas about heaven, and this patient has been an atheist throughout. So that is not your role. You're asking them now, go and be baptized. They don't know. You just stick within your limits, just assess and facilitate. If they need that requirement, then talk or call the right person to be able to attend to that patient. So you should also provide the patient and family suitable and practical coping methods and encourage the use of self-help devices if necessary. So knowing the patient values, religion, and belief will go a long way in assisting you in helping the patient. So you can just facilitate about matters of values and religion, but it is not your role. So when we're talking about now prevention of chronic illness, we also play a very key role, and that includes provision of good prenatal, postpartum and delivery care. We can have genetic counseling should be done so that we don't have patients who are terminally or chronically ill. So you can do the genetic counseling so that we don't end up with patients, maybe a lot of patients with Down syndrome, with Edwards syndromes, all those syndromes, and also some conditions that follow genetic lineage. So discouraging risky habits such as smoking and overconsumption of alcohol in order to reduce lung conditions, liver cirrhosis, and mental disorders. Remember, this qualifies us as a chronic illness. So early diagnosis and treatment, regular exercise, very important, and also healthy diet. And then secondary prevention, we can be able to organize for regular medical checkups and screening measures, including pap smear, self-breast exam, and screening should take place at home, school, and community level. So all this, the nurse can be able, is instrumental in ensuring that we prevent chronic illness, or we reduce, because some of the chronic illnesses, when we find them at an early stage, we can be able to treat. And then in tertiary prevention, we can be able to give first aid, treatment, and rehabilitation of diseases, since it aims at preventing complications and disabilities. That one is in tertiary prevention. So any contribution up to there? You have been very quiet. You know, even if you are very quiet, you are likely to doze off. Ayub, any contribution that you can be able to say, Ayub or Pio, from your own experiences?
Yes, sir.
You can be able to share. Yes. What is your experience with chronic ill patient? Ayub, have you ever encountered one before in the community? And if so, how have you been able to assist? You like to hear?
Okay. Hello.
Yes, we can hear you, Ayub.
Hello, can you hear me?
Hello? Yes, I can hear you.
Hello, can you hear me, sir?
Yes, Ayub, I can be able to hear you loud and clear. Go on.
I have hello.
Yes.
I have encountered several of them, but maybe before then I was not yet having managed such kind of chronic conditions, so I was not able to handle them. But what I also realized with the community is that when somebody is having a chronic illness, there is a lot of stigmatization and a lot of so you find these people are just rejected and abandoned by the society, the community, and that makes the life of the condition of these people deteriorate more and die, not even like human being with dignity, but like just animals or dogs. So at this point, after getting the knowledge, I am in a position right now to handle such cases and also educate the community to see a way of how they can handle them.
Thank you very much, Ayub, for that. From your experience, that you have been able to see that these chronic illness persons, basically people treat them as worthless persons. From what we have been able to hear from Ayub, so basically can be able at least to be in a position and tell them that these are patients under difficult circumstances. They have to go through those phases to be able to assist them. So maybe you can hear also again from Joyce. Joyce Nabwire, are you there? Joyce?
Yes.
Yes. Could we just be able to hear from your experience with chronic illness patients?
Yes, I have met some of them. As I have detected, they are abandoned by their neighbors. Them also, but no one can come and see them.
Okay. Thank you very much, Joyce. I think we have heard you. And maybe if we can hear from Tracy Nyagodi. Have you had an experience before with a patient with chronic illness, and how did you assist them?
Yes, I've had an experience. Someone who has like hypertension and veins, and I can say I didn't really treat them well. I was not really compassionate. I was a bit okay. I can say I was the kind of person who says this patient is being difficult or something like that. But saying nimejua. Yeah.
Thank you very much, Tracy, for that insight. Alice Kimani, just to say a few of your experience before.
Hey everyone.
Hello.
Yeah, I think I've interacted with the chronically ill patients on very different occasions. You know, there are those that have chronic illnesses, but it's not like they are sick. Like now, the cases of somebody who has diabetes.
Uh-huh.
Yeah, you just manage them maybe with diet, like, and they'll be good.
And do you talk to their families again, also just to ensure that they can be able to understand the circumstances of the patient on what they are thinking about financially? Because you have already known there is a lot of worry and uncertainty. So, do you also talk to their relatives?
Yeah, yeah, you have to talk to their relatives, especially if like it's like in the initial stages, they don't
Mhm.
know how to manage this thing. It's like something total new to them. They think it's the end of life, but you just encourage them and you tell them with the right if they follow like the guidelines, it's gonna be okay.
So, you try to also instill some hope.
Yeah.
Well, thank you very much, Alice. Okay, so we can carry on for about 15 minutes and then we end the lesson. So, thank you very much all for your contributions. So, we also have individuals whom we call displaced persons. Displaced persons. These are still, remember in our first objective, we were talking about identifying those people who have, identifying those people who have special needs. So far we have seen we have the abandoned children or the children in need, we have the elderly, we have the chronically ill, and then now we're talking about the displaced persons. So these are people who have been displaced from their community or even countries. And you find that the displacement of people can be caused by a number of factors, and the most common being armed conflict. We just had post-election violence the other day. People can be displaced because of natural disasters like flooding. We have volcanic eruptions. We have famine that may come. It could also be political reasons and also economical changes, which can be able to influence or displace a person. So this displaced person, we can categorize it into two categories. There are those people who are internally displaced and those ones who are externally displaced. So the internally displaced persons, these are people who have been displaced within their country. It could be following some ethnic clashes or disasters such as flood and earthquake. So this has actually been happening all year round within our country. You go to Budalangi in Busia, you find people have been displaced because of the surging waters of Lake Victoria, which have now even which breaks the dikes. When you go to right now in Baringo, I understand in Baringo, I'm not really sure. You go to people who live around Lake Nakuru, they have been displaced by flooding. So they are internally displaced. They don't have schooling, they don't have homes, they don't have nutrition. So these are people who are in need. We also have externally displaced persons. These are people who run away from their countries because of civil war or political persecutions. You go to South Sudan, our neighbor. Actually, Kenya, we have been so privileged to have hosted nearly all our neighbors who have run away from their country because of political instabilities. You go to South Sudan where you find the post-John Rang death, you find there are still some warring communities led by two factions by their president, Dr. Salva Kiir and Dr. Riek Machar. So people are escaping from South Sudan. They are coming to Kenya. We host them. We have people who have run away from Somalia for a very long time. So we have Kenya hosts the highest number of refugees in the world. We have the Kakuma refugee camp. We also have Dadaab, just hosting more than 1 million persons. So they are known as refugees, these people who are externally displaced. So the government works closely with the United Nations High Commission for Refugees, or the UNHCR, to be able to settle these externally displaced persons. So I have colleagues and friends whom we went together with at the university. Some of them are working in these refugee camps, the Dadaab and the Kakuma. I even had my cousin who was working there with them. So you may find yourself working with these persons, or some of you can even be required to assist in policy development at the level of the UNHCR to be able to come out with policies of repatriating as well as assisting these persons who have been externally displaced. So the problems that these people have majorly, they have problem with housing, sanitation, water supply, lack of inadequate nutrition, security risks, and human rights violation, because you find here there is lack of security. People are killing one another with just a small trigger. People are really frustrated. There is overcrowding within those areas where people have been displaced. There is lack of education opportunities, lack of health services, emotional needs, and poverty. All these are challenges or problems that these people find themselves in. And remember, this problem they have not brought on themselves. It is just the circumstance that has dictated or has made them to be that way. So the displaced person tend to develop health problems due to poor living conditions, as well as psychological and physical trauma caused by displacement. So some displaced persons are separated from their families and relatives. They have lost jobs. They have lost homes. They have lost schooling. Therefore, they need some material as well as psychological care, and some may develop antisocial behavior as defense mechanism, as they are unhappy about the whole thing of displacement. So it is important that some measures be taken to help them, whereby apart from the above problems, you find that they have, they can also be, this displacement can bring forth new diseases, because when people are put together in some camp somewhere, they are coming from wherever they are coming from with different issues. Some of them are hosts for some diseases. So they will come and spread. Remember, the living conditions are poor. There is inadequate water. Everything is just in mess. So you find a catastrophe can come to these people where they can have diarrheal diseases, typhoid, measles, meningitis, STDs like HIV. So when you are working with this community, you have to understand their needs. So if you have to ensure that sanitation of where these people are is improved, so that we prevent outbreaks of diseases. We have to ensure that, because these people are physical beings, they may want now to engage in some sexual activity just for relaxation, at least to take their mind away from their circumstance. So illnesses like HIV, AIDS will be prone, and therefore we need to ensure that we assist them. So even the animals, or the animal that they bring together with the camp, can also bring diseases such as rabies, anthrax, foot and mouth diseases, brucellosis, East Coast fever, trypanosomiasis, and so on and so forth. So not only when you work with them are you taking care of persons, but you are also taking care of their animals as well. So that's why you find in those camps, before someone is admitted they will have to undergo, or if you are working with them as the healthcare worker, you have to screen them for diseases, screen them for diarrheal diseases, typhoid, because remember they are human hosts as well as animal hosts, so that you don't end up with an outbreak in a refugee camp. Imagine a refugee camp hosting about 1 million people. There's an outbreak of typhoid. How long will it take for the healthcare provider to contain that outbreak? So it is important to understand their healthcare needs. So the effects of displacement of people. Displacement often leads to dramatic changes in the family structure and the gender roles. Yeah, if you apply the Gordon's functional health pattern, I want to urge you to go and read the Gordon's. Just take time when you are just not busy. Google it, just look at the Gordon's functional health pattern and read and see what is health perception, what is role, what is coping, in that functional health pattern. So you will understand and you can integrate it into your practice, whereby you don't see a person as an individual, but you see him as a whole complex of a system. So in conflict situations, many women are suddenly thrust to be the head of the household because men are recruited for combat and they stay behind to maintain land or migrate in search of work. So there is also some escalation in level of poverty, a reduction in the level of foreign aids, demographic consequences, a religious effect, and conflict between human and host, and also political effects. So the services available for these people, we have relief agencies. The relief agencies that usually come to be able to assist those people who are externally. They can bring blankets, they can bring food stuff, they can be able to bring soap, those things that a person generally require for survival. So we have relief agencies, we have non-governmental organizations that assist, the government also through the county government, the church, institutions like the United Nations Commission for High Commission for Refugees also assist. So they provide them with shelter, medical care, food, clothing, and so on. So you advocate for the patient, and then you also you can be able to volunteer. Basically, when you are working with these people, sometimes you may need to, or there is a call for volunteers. So you volunteer yourself, you step forward, and you are able now to offer the simple healthcare that you can be able to offer. So refugees have some sort of international protection where their needs are catered for by the United Nations High Commission for the refugees. So for the internally displaced, who are basically citizens in their country, are not afforded the protection of the United Nations High Commission for Refugees. So the International Committee of Red Cross protects the right internally, those people who have been displaced internally, and it conducts protection and assistance programs for these victims. So the Red Cross works very closely with those internally displaced. But for the externally, you're working in Dadaab, Kakuma camp, then you will work under the United Nations High Commission for the Refugees. So how do we manage the displaced person? Your role as the community health nurse will be to work with other healthcare workers as a team in order to deal with the various problems, where you can be able to screen or set up relief centers to screen and give first aids for new arrival. You can be able to offer food assistance, especially to infants and children, as food is a basic need. You can also organize for temporary shelter so that the individuals can sleep and rest, and also reproductive health services. You can also be able to offer them, like the antenatal, labor, delivery, and postnatal, as well as family planning services. So the medical services that you offer could be curative or preventive. Immunization programs, you can again or as well be able to offer them. You can do or organize or have health education and community mobilization, and also identification and use of community health workers in the area if necessary. So it's very, very key when these community health care workers actually assist, or they have a critical role again in attending or giving the care to these displaced persons. Also, emergency services can also be given to those people. So we also have the widows and the widowers. So the widows and widowers is because of the death of a spouse, which can make one either a widow or a widower. So you have many of them in your community, and some leading causes of death today, or can make a person to be a widow or widowers, is road traffic accident and diseases. So all these diseases can be able to cause major mobility and mortality, and subject or cause one to be a widow or a widower. So this one I will not like to go over it, where we are talking about the road traffic accidents, which, you know, if you have an unroadworthy vehicle, you are a careless driver, poor enforcement of regulation, and so on, can lead to road traffic. So what are the needs for the widows? We have psychological effect, where they are now they are trying to cope with the loneliness, cultural practices. They are facing poverty. Some of them may face violence because of some practices where which are still being practiced, like wife inheritance, which is common. So these people can face some violence and intimidation and so on. So they have a lot of needs apart from the basic ones like food and shelter, if the person who died basically was the breadwinner. They can also be exploited at their work environment. They lack love, or they desire love and belonging. And then you also have loneliness, among others. So the services that are available for the widows and widowers, in Kenya, we don't have any formal system that is available. So we can just assist them through community support, which can be able to provide some relief. So we can make good use of the extended family members, whereby they come in handy in supporting during the grieving period, when one is mourning and grieving. So they can be able to come and comfort them, just the way we do in an African way, where we can be able to visit, we can be able to come, assist, and see just that emotional support. And then also we can do harambees if possible, to be able to raise something for the widows and the widowers. Mostly the widows. Even the church, even the Bible, if you are Christian, it tells you that you should be able to take care of the orphans and widows, wamama ambao ni wajane na watoto ambao wamefiwa, just in case they cannot be able to provide for themselves. So we can be able to organize these social things, or we can be able to, when there is any social form of social gathering, you can be able to attend. So basically, we can all be able to apply this if we normally attend, because the avenue will not come to you, but you are supposed to also go and look for these avenues. For example, you hear the National Nursing Association have called for a meeting. So you don't want to go there because there is no motivation. you are supposed to take that initiative and go there and try to change. In that forum is where you can be able to express your new way of doing things. So I like to encourage you that when you hear those meetings are being called professional meetings, village meetings, make use of that. So that when you attend there, you can be able to contribute. You can be, if it's professional wise, you can be able to shape the direction of the profession, because you can be able to give input. When it is social gathering, you can be able to go and contribute socially within the community. So don't sit there and say that there is no avenue, sijui nitafanyaje nifikie hawa watu. There are those things that happen within our locality. Make good use of them. Use those forums to teach. Use churches, use professional gatherings, use community gatherings to be able to reach out to these persons. So also the clan can be able to play a big role in taking care of the widow, where the clan takes the responsibility of children education and may even assign individual members of the family responsibility over children. So we can be able to take care of that through them. We also have support groups and assist them, where, for example, we have the Widow and Orphan AIDS Kenya, WOFAC, which can be able to provide help to this group, where they can be able to share their problems, help them teach one another, and have that social support. So that marks the end of social or people with social needs. So we have been able to cover special needs. We have identified the special needs persons. We have identified the nursing roles which you can be able to play, and we have been able to identify the social structures within the community, within the family, and within the republic that can be able to assist our displaced person. So mine is just to urge you that you being a nurse, you have lots of forums where you can be able to bring change. You hear any form of gathering, professional, social, and you think that you can be able to impact, please step forward and be counted. Don't stay back. Don't hold back. Don't stay at home and say that there is no forums. You hear a scientific conference, let people know you. Someday you will want to be the president of those associations. Emmanuel, let people know you. That is where you can be able to build your name and be known. But if you light your candle, put it under the burn shell, nobody will know you, and therefore will have zero impact to the community. I'm not talking to Emmanuel Mengo only. I'm also talking to Aurelia, to Anne Waidera, to Beret. We're talking to Diana Mwende, to Eda, and so on, and even Esther. So please, let us make use of that. We are senior people in the community, and also the one important thing, when we are dealing with our patients, compassion, we have to have it. Let us understand that there is no difficult patient. It's a patient under difficult circumstances. Thank you very much for listening to me and attending to this lesson. So any contribution, any addition from the members is welcome. Okay, having been no question, I will now stop the recording, and then I will leave. So tomorrow we prepare for project management because we are finished. Ayub, we have finished class, don't worry. This is the last session, Helen, for social commissions, but we still have project management tomorrow. Is it tomorrow or on Friday?
Can't it, excuse me, Mwalimu, can't it go to
Yes,
next
Alice.
week? Can't it go to next week? Tomorrow
You
we
want
have
it
a
next
cut.
week?
Because tomorrow we have a cut and Friday we also have a cut.
It's okay. We shall have it next week then. Hata mimi nimechoka.
Aki yenyewe pumzika.
So I will ask you for a day next week, and then we shall see when we shall have it. So we will not have any other class, so that you can be able to read for your online class.
Okay, thank you.
Thank you. Have a nice time.